Hi everyone, welcome to week 2 of PA215, which is your pharmacy capstone course. This is your last course of your pharmacy tech series. So this is really the series where you're going to be interacting with each other and with the scenarios on your CD so that we can kind of get an idea of what would you do if kind of a thing. One thing that I want to point out is when you are doing your scenarios, your assignment is actually to show me that you did the scenario. And you can do that by just taking a screenshot or a picture and uploading that in the Canvas so that you can show me that you completed it. So it's an easy 40 points. There's no right or wrong. You either did it or you didn't do it. So you can just upload that and show me that you completed the scenario. Now, along with that is your discussion each week. Now, your discussion is all about the scenario. So I would recommend that you do the scenario first, and then you spend some time going through and talking about that in the discussion post. So obviously, you'll want to do that before Wednesday because you want to have your initial post by Wednesday at midnight. So what you'll do is you'll go in and you'll talk about what did you do. Maybe you did the scenario, but it gave you some pointers and said, oh, yeah, wait a minute, you got to do this first. Or, nope, that's not the right order to do that in. Talk about that. Talk about any mistakes you may have made because that's a way to learn. Talk about questions that you may have had. I'm not understanding why we have to do this before we do this. Any of those kinds of things. And of course, since the scenarios are involving patients and things like that, coworkers, talk a little bit about that. What if I would do this instead? Would that be acceptable? Ask those kinds of questions in the discussion post. That gives your classmates as well as me an option to respond and give you feedback, and so that we can basically have a back and forth discussion about how things really work in the real world. So that's something to keep in mind. Definitely try to get that scenario done before you try the discussion, since that's what the discussion's all about. Then also make sure that you go in after you post your initial one and respond. Respond to classmates. Respond to me. You need to have at least 2 responses in addition to your initial post. So that's a total of 3 posts each week to earn full credit. Remember, the first post has to be 250 words, and then each response needs to be at least 50. So that kind of gives you a guideline about what to do and how to get started on that. Now, the last thing that you'll want to make sure that you're prepared for each week is your quiz. Now, this week, the quiz says it's over Pharmacology 1 and 2. So the pharmacology book that you guys have for this, for all of your courses is this one. So I would make sure that you have this one handy, that you've reviewed some of the key things within this one. And keep in mind that, this is a review course, so this is all about what you already know. So to say go in and study a specific chapter or make sure you learn this chapter, you already have done this. So you should already have a fairly good background in a lot of this. Now, I would definitely recommend in this book that you look over chapter 1. It's a good overview of the entire textbook. But of course, keep in mind that this book covers everything. So not only are we looking at, the history of pharmacology, which is what chapter 1 is all about, but then the rest of the textbook is about the drugs and how they're used by the body and the different systems, and then in drug categories. So keep in mind that when we think about drugs, we can think about them we can group them a lot of different ways, right? We can classify people a lot of different ways, right? So, some people might classify me as middle-aged. Some might not. Some might say I'm a little older than that. But some might say I'm a woman too, right? So I fall into different categories. Same with drugs. Drugs will fall into different categories. They might fall into the category of what system am I going to use it in? Is it a musculoskeletal drug? Is it a drug that's going to be used for, the cardiovascular system? Things like that. So that's what Unit 2 is all about in this particular book. And then Unit 3 is what category do they fall in as far as what are they for? Are they for infection, or are they for pain relief, analgesics, things like that? So, that's why we have these different chapters, is we're just looking at them with different eyes. Okay. But if I were to tell you to look at a particular chapter to kind of give you an overview, maybe jog your memory, remind you of what we covered in this book already, I would definitely recommend that you go back and reread chapter 1 before you attempt the quiz this week. The quiz will be 25 points and 25 questions, so 1 point per question. So as you're going through this, and even once you've taken the quiz and you go back and review, if there's problems, questions, things you're not sure about, things you didn't get the first time and you still don't understand, make sure that you reach out to me. That's what I'm here for. And I hope you have a great week, and I'll talk to you soon.